In 2022, an Iranian woman named Mahsa Amini was arrested for failing to properly wear a hijab and later died in police custody. Protests followed, and there was a brutal crackdown by the Iranian regime. In response, the Canadian government made it easier for Iranians who are already here, working, studying, or visiting family to stay longer. They also made it easier to get an open work permit. Most provinces also gave them healthcare coverage as long as they had a valid permit, were working full-time, and met certain requirements. Quebec did not.
The Quebec government just has a tougher stance on immigration.
Quebec is more accommodating if the immigration is driven by economic needs and benefits Quebec businesses. But experts say these days the government isn't eager to take on temporary residents it didn't specifically ask for.
There seems to be a problem when it comes to reciprocity.
And Iranians here aren't alone. Chen says that other communities have faced similar challenges. Although there are a few exceptions, people on an open work permit in Quebec are not able to get RAMQ. Chen suspects that Quebec is worried about so-called medical tourism, but he doesn't think that that's why people are here.
If these individuals are most likely eventually going to be part of our community, then why not set them up on a good footing, allow them to thrive, as opposed to put them in such a precarious situation that they develop poor health.
That was the case for Samaye Amadi Siddig. She moved to Quebec City with her 4-year-old daughter a year ago. She has an open work permit and works at a clothing store. A few weeks ago, a metal ladder fell and hit her in the head.
وضعیت خیلی بد بود چون من هم حالت تهوع داشتم خیلی شدید هم سرگیجه اصلا تعادل نداشتم که روی پاهام وایستم.
When Amadi Siddig got to the hospital, she was told it would cost $1,200 to see a doctor because she didn't have RAMQ. She was unsure if her private insurance would reimburse the cost, so she returned home not knowing the extent of her injuries.
و این حس قشنگی نداره. این یه تبعیضه به نظرم و اصلا قشنگ نیست. انسانی نیست به نظرم.
Sahar Satani worries that she chose the wrong place to live. She said friends who settled in other provinces haven't run into the same problems.
خب احساس عقب افتادن از بقیه رو دارم.
Last year, Quebec made a special exception and extended healthcare coverage for another group of newcomers, Ukrainian refugees who also have open work permits. Sultani doesn't understand why Quebec won't make the same exception for Iranians, but RAMQ said the Ukrainian situation is unique. Quebec's Ministry of Health didn't respond to our questions as to why they're not treating Iranians the same way. But Chen says there could be a simple fix. The Canadian government could extend the interim federal health care coverage, which is usually used for refugees and refugee claimants.
Especially in this particular case, part of the reason why there's this temporary program being extended to the Iranian community is because of the concern about the conditions at home, right? So in Iran. In my view, anyway, this puts this group of people similar to refugees.
The federal government says healthcare is up to the provinces. Amadi Siddig left Iran because she wanted a better life for her daughter. She hopes Quebec will reconsider its policy to help make that a reality.